Good morning to you. Richard Pryor and Selma Blair, just some big names who have battled multiple sclerosis. Now we've had another big name sharing of their diagnosis. And this is CNN's John King. He is sharing what he's been going through. This is a big deal. It is an autoimmune disease. It can be debilitating. Some have come to manage their symptoms and live fulfilling lives. But Am Romney, again, Montel Williams, also some names who have had MS and were diagnosed. It's been interesting to talk about whether this is the same MS for everyone across the board. So we wanted to bring in our medical expert here. And also there's been a discussion about vaccines and how those vaccines can actually impact someone who's been diagnosed. Thankfully, we have somebody here who can speak to this a little bit more adeptly. You have extreme insights into this. Dr. Elena Grebenciucova is a neurologist and MS expert at Northwestern Memorial Hospital. Thank you for being with us. I have to first ask, John King saying that he has MS, is this going to affect him like we've seen it affect someone like Selma Blair, who's been in and out of, we've seen her battling with it, a struggle with even being able to talk or walk or move. And then we've seen people who seem to live life almost normally.
Absolutely, exactly. There's 1 million people who live with multiple sclerosis in the United States, and MS affects everyone so differently. So there's rarely a person who has exactly the same symptoms as the other one. Some people are affected actually very mildly, some moderately, and some more severely, depending on the timing of their diagnosis, the level of treatment they received, and other risk factors. And so not everybody uniformly has really aggressive MS or severe MS. Some people can actually, particularly when they start highly effective treatments, they can do very well. They can live very normal lives. I mean, they may have some residual symptoms and they may struggle with some what we call invisible symptoms such as fatigue, sometimes neuropathic pain, but people can do very well today.
Yeah, and what about how you actually contract MS? How is it caused? Is it a lifestyle disease? Is it something that's genetic?
It's not strictly speaking a genetic disease. While there may be some level of genetic predisposition, it's not as straightforward as if mom has MS, the child has MS. But it's a multifactorial disease where your immune system essentially makes a mistake and starts from time to time attacking the myelin, the wrapping around the nerves in your brain and spinal cord. So it is multifactorial, and there are environmental risk factors such as low vitamin D, being overweight or obese, and smoking. Those are modifiable risk factors in a prevention of MS.
Somebody who has MS receiving the COVID-19 vaccine, would that have any effect on them?
So patients with MS should receive COVID-19 vaccines, absolutely. The problem, of course, is that as a community, we need to come together and support those patients because many of them are immunocompromised, just like Mr. King. So they are on medications that make them less able to mount an effective antibody response. So they are not able to protect themselves as well as you or I. Therefore, they are they're more vulnerable to COVID infection. So as a community, all of us know people, maybe family members or friends who have MS, and it's our duty to protect them. So everybody should get vaccinated, and certainly patients with MS should as well.
Dr. Grebenciucova, thank you so much for being with us. We appreciate your time.